Good evening, friends. It is my proud privilege to present to you Dr. Arpana Haritwal, who is the Senior Consultant Obstetrician and Gynaecologist at Max Smart Super Specialty Hospital, Saket, and also at Shada Clinical Lab. Today, we'll be discussing about the cervical cancer vaccination. But before we go to the topic, I will just like to add a few opening remarks. Cervical cancer forms 16.5% of the total number of cancer cases in Indian women, breast cancer being the first. It is estimated that about 160 million women between the ages of 30 and 59 years are at the risk of developing cervical cancer in India, with 96,922 cases registered alone in 2018. I was trying to find out why is it that many women with cervical cancer are diagnosed late. Research shows that the countries with a low socio-demographic index have a high number of women who succumb to cervical cancer. Some causes are, in India, many women seek treatment only when the cancer is already advanced, making the treatment and recovery difficult. And those who approach for the treatment on time, treatment may not be available or it can be prohibitively costly. Unlike women in developed economies that are part of regular screening programs, women in India do not take part in regular screenings. In fact, there is a stigma or shame attached with pelvic examination in India, and that has a huge role in late diagnosis. Cervical cancer is most likely caused by HPV 16, HPV 18 virus. No other causes have been identified so far. Some other factors like unprotected sex with multiple partners, sexually transmitted infections, chlamydia, weak immune system, and smoking can be these factors. I now invite Dr. Arpana Haritwal to take us through the journey of HPV vaccination.
Good evening, Dr. Gupta. Thank you for giving me this opportunity to speak on such an important topic of HPV vaccination, which is of global concern. So we all know that HPV vaccine, human papilloma virus vaccine, it is one of the most efficacious vaccine preventive against HPV infections. There are three types of FDA-approved vaccines available till now. One is the bivalent vaccine, which is preventive against 2 HPV subtypes, quadrivalent vaccine, which is protective against 4 HPV subtypes, and the 9-valent vaccine, which is protective against 9 HPV subtypes.
Will you guide us at what are the recommendations about the vaccination?
So today, the information which I'll be sharing about HPV vaccination is as per the recommendations given by the ACOG, that is American College of Obstetrician and Gynaecologists, and the Advisory Committee on Immunization Practices. So as per these recommendations, HPV vaccination is recommended for all girls and boys at the target age of 11 to 12 years. Now, the dosing depends on at what age the immunization is started. If the first dose of HPV vaccine is given at less than 15 years of age, then the number of doses is 2. The first one, which is considered at 0, that is the baseline dose, and the second one is to be given 6 to 12 months after the first dose. Now, this interval of 6 months between the two doses is very critical to ensure adequate immune response. However, if the time interval between the two doses is less than 5 months, in that case, a third dose is recommended. Now, for more than equal to 15 years of age, if first dose is given at more than or equal to 15 years of age, in that case, 3 doses are recommended. The first one, 0, that is the baseline. The second dose is to be given 1 to 2 months after the first dose. And the third dose is to be given 6 months after the first dose. So this is to be remembered. Now, another important thing is minimum time interval between the two doses. The minimum time interval between the first 2 doses is 4 weeks. The minimum time interval between the second and third dose has to be 12 weeks. And the minimum time interval between the first and third dose has to be 5 months.
And Dr. Arpana, just excuse my ignorance, why are the boys to be vaccinated?
Boys also have the risk of anogenital cancers, oropharyngeal cancers, and the genital warts. So that is why boys also need to be vaccinated. And then this HPV infection is sexually transmitted. Okay, so that's why boys also need to be vaccinated. And then vaccination of boys will lead to herd immunity in the community.
And as you said, perhaps they will be infecting the females.
Yeah.
And what is the preferred time of vaccination? Early, late, or what?
Preferred time with the target age has to be 11 to 12 years. ACOG, Advisory the Committee on Immunization Practices, American Cancer Society. So all of them recommend that the target age has to be 11 to 12 years of age group. However, even between 15 to 26 years of age group, vaccination can be done. But yes, immune response may be less or vaccine efficacy may be less in case the sexual exposure has already occurred. Although in 15 to 26 years of age group, it is highly unlikely that infection with all the HPV, 9 HPV vaccine subtypes has occurred. So yes, benefit will definitely be there. But in more than 26 years of age, it is highly unlikely that the infection with all the HPV vaccine subtypes has not occurred. So it is not overall public health benefit is not there in vaccinating more than 26 years of age. So that's why the catch-up immunization is not offered for more than 26 years of age. But between 15 to 26 years of age, it is the responsibility of each and every medical practitioner to offer HPV vaccination in this age group, irrespective of sexual exposure, irrespective of the sexual activity, and irrespective of the HPV DNA status. So HPV, even this HPV DNA test is not recommended before HPV vaccination in this age group, 15 to 26 years.
But madam, what is the situation? I come across sometimes that the mother or the father comes for the vaccination of the teen girl, and then father says, "Why not vaccinate my wife also?"
Yes. So regarding this, what I would say is if a female is more than 26 years of age, vaccination is safe. She can be given vaccination, but then that has to be a shared decision making after explaining the risk of HPV infection to that female and the benefit of the vaccine. So in United States, yes, the vaccination is licensed for women up to 45 years of age, and it is safe. But then it is not sure whether this vaccine will be beneficial for her or not.
So we can say that in monogamous relationship, maybe it is not that recommended.
Yeah, it is not recommended for women who have been in long-term monogamous relationship. So HPV vaccination is not recommended for them. But for women who have not been committed to long-term monogamous relationship, or for women who have been recently diagnosed with some sexually transmitted infection, in that case, HPV vaccination can be recommended even in this age group, more than 26 years of age group.
Any other special point you like to mention?
Yes. Now, there are certain points of special mention. First is pregnancy. People are curious that if HPV vaccination can be done during pregnancy or not. So certain points have to be remembered regarding this. Number one, HPV vaccination is not done during pregnancy. But yes, if some pregnant women inadvertently got administered this HPV vaccine, safety data are reassuring, although limited. Now, if somebody has received the HPV vaccination first dose, and after that she becomes pregnant, so in that case, she has to get the series of vaccination completed once the pregnancy is over. Another point is, yeah, we can withhold it and then she can complete. She doesn't need to get the whole series done later on. If she has received the first dose, she can get second or third dose done once her pregnancy is over. Now, another point of concern is for breastfeeding women. Breastfeeding women less than 26 years of age can get vaccinated and have to be vaccinated with the HPV vaccine if they have not been vaccinated earlier.
And what about the patient with HIV immunosuppressed states?
Yes, for them, HPV vaccination is no contraindication. They can get the HPV vaccination done. And yes, the immune response may be less, and the 3 doses have to be given. Even for less than 15 years of age, in such cases, 3 doses have to be given. Another important concern is for children with history of sexual assault or sexual abuse. In such cases, HPV vaccination is to be done as soon as possible, starting at 9 years of age.
And can this vaccine be given along with the other vaccines concomitantly?
Yes, as per the ACOG and ACIP recommendations, HPV vaccination can be done concomitantly with other age-related vaccines such as tetanus, DPT, and polio.
Any word about boosters or revaccination or series?
Till now, there are no current recommendations regarding the booster dose of HPV vaccination. Now, as far as revaccination is concerned, people are concerned that now this 9-valent vaccine is available there in the market. So, do they need to get the 9-valent vaccine done? No, if they already got their series completed with the bivalent or quadrivalent vaccine, there is no need to get revaccinated with the 9-valent vaccine. Another thing is that in case any dose of HPV vaccine is missed, irrespective of the amount of time of delay, the series can complete it anytime. And another thing is that supposedly if any HPV vaccine product is not available, so you can complete the series with the other available HPV vaccine products. So if you got the bivalent vaccine done as a first dose, preferable is that you should get the series completed with the same vaccine product. But if in case it is not available, any of the HPV vaccine product can be used to complete the series.
How safe is the vaccine?
Safety data are reassuring regarding this HPV vaccine. There are no serious adverse events related to this HPV vaccination. With the 9-valent vaccine, there are higher rates of injection site swelling and erythema. Then the syncope and site reactions are common. So adolescents should be observed for minimum 15 minutes after doing this HPV vaccination. If anybody has febrile illness, then one should wait for this febrile illness to get over and then get the HPV vaccination done.
Once a female or has been vaccinated with the HPV, do we continue the screening for the cervical cancer?
Yes, that is a very important point. Screening has to be continued as per the routine screening guidelines. So even if you have been vaccinated, you need to continue with the screening for cervical cancer.
As a practitioner, before we end, I would just like to be clear that whatever brand we use, all the brands are equally effective.
Yes. Although if cost and availability is not an issue, it is said that 9-valent vaccine should be preferred. But yes, there is no difference regarding the efficacy. Whatever brand is available, you can get vaccinated with that.
And you highly recommend vaccination with HPV?
HPV vaccination, it is the global concern now. Recently in 2018, WHO has given the global strategy for about 90% coverage of HPV vaccination. And WHO rather says that the primary target should be females between 9 to 14 years of age. Earlier vaccination is preferred because it has two advantages. One is the vaccine is most effective if it is given prior to exposure to HPV infection, which coincides with the onset of sexual activity. And other advantage is that only 2 doses are required if it is given earlier.
Thank you, Dr. Arpana. You've given all the insight into the vaccination. Thank you very much.
Thank you.